Welcome, everyone, to Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You are listening to 88.1 FM, KPPP-LP, Fargo, Moorhead, where we are adding local color to your airwaves. And more information tonight about the pandemic. Special show tonight all about healthcare workers. I have a very special message about our healthcare system, about our healthcare workers, and how they are going to be affected, how they are being affected right now by the pandemic, not in Spain, not in Italy, not in France, right here in the good old US of A. It is a powerful message that I will be sharing. I want to ask every single person on this live stream that is listening to us in the Fargo Moorhead metro area to share the information that I am going to give you tonight. It is crucial. We cannot sit on the sidelines, not this time, not during a pandemic. I know a lot of us are used to just biting our tongues. We're used to staying quiet when it comes to controversial issues, when it comes to things that are politicized, when it comes to things that make us feel afraid of a confrontation with a friend, a neighbor, or a family member. But hear me. Hear what I am saying to you. You cannot stay silent. This is the difference between life and death. I have made sure to call every family member, every friend, every person that I care about personally and ask them if they are taking this pandemic seriously. Ask them about their protocols for hygiene, for work, and everything else. And I want everyone to be doing the same thing. But more importantly, we need to make sure everyone understands that they have to work to flatten the curve. Flatten the curve. What we are seeing playing out right now in New York is a little taste of what is going to be coming to the Midwest in 2 weeks. And it is terrifying. It is horrifying. We cannot allow this to happen to our communities, to our healthcare workers. And so it is for them that tonight I am doing this special broadcast. First, though, I want to thank everyone that listens to us here in the metro area as well as across the nation and around the world. Thank you for choosing 88.1 FM. Thank you for listening to A Mexican Crossing Lines. We will be bringing you exclusive content on the COVID-19 virus for as long as this takes, because we want people to be informed and we want you to have the best information. I know there's a lot of burnout right now. I know there's a lot of people that are burned out. You're stressed. Maybe you're depressed. Maybe you have already been sheltering in place for a week or two, and you're scared. You're just scared because you don't know. That's why we're curating the best information for you here. So you don't have to spend hours and hours and hours and most of your day trying to find what the real news is and differentiate it from the fake news and figure out how you're supposed to protect your family. You can come and watch this show, listen to this programming, and you can rest assured that you're getting the most up-to-date information. So I would like to ask everyone to follow us on social media, follow us on Twitter, on YouTube, on Facebook, and feel free to contact us through our message line or our emails if you have tips or stories that you want us to cover. Right, Dick?
Yeah, you're our sources out there. We've gotten a lot of information over the years. We build our shows off of the crowdsourcing that you all done, and thank you for your support. You can do email to Cindy at kpppfm.com or Duke at kpppfm.com. As Cindy mentioned, the call-in line is 701-566-0917. That's 701-566-0917. You can leave a message up to about 3 minutes, and we could put it on the air, or if it's just tidbits of information you want to share with us, that would be great. You can also go to our YouTube channel. It's Duke1517, and we do our streams there too. In fact, all these streams that we're doing on Facebook, we're uploading to YouTube as premieres so people can actually comment on them. So they're in several places. And we also have kppfm.com, where we kind of put all of our stuff together, where it's one easy stop to look at our shows. I have a playlist going on our YouTube channel, so the Coronavirus Radio. And so you can see all the shows that deal with the coronavirus there in one spot. You can tweet us at media_PPP. And when you're at kppfm.com, please don't hesitate to support us. We're a nonprofit organization, radio station in Fargo, Moorhead, non-commercial. You can make a tax-deductible donation to our station to help keep us going. Go to kppfm.com/donate. And thank you for joining us tonight.
Yes, indeed. Now, let's go right to the numbers. Okay, folks, this is really scary. I see that we have somebody commenting from New York. One of the comments we get from New York is from Brenda. Brenda says that she is in New York, going stir crazy, but staying positive. Brenda, hang in there. It's the best for everyone, as I'm sure you're aware. And also, we got a shout out from New York lab technologists thanking us for staying vigilant. Yes.
That's great.
Take a look at the numbers. They've jumped dramatically. We are almost at 500,000, 451,355 confirmed cases. We are so close now to surpassing Italy's numbers. And Italy has an alarming number of people that have overwhelmed their healthcare system. They're at 74,386, and they haven't reached peak. They haven't flattened the curve. They're right behind China, and the United States is already just 10,000 behind. So by tomorrow or the day after, we will surpass Italy in the number of cases of this virus.
It's moving so fast.
That cannot be good. Yes, that's what people seem not to understand, unfortunately. Here in the U.S., we have 65,652 cases. We are at 931 deaths. 931 deaths. You have 800 because
that jumped almost 100 deaths in the past hour, 2 hours.
Yes, that's right, Duke. So if you're doing the math in your head, you know that by tomorrow we will be at over 1,000, and that in a couple of days after that we will surpass 2,000. That number will then double, and then we'll be at 4,000. So we really need to heed what the healthcare workers are saying to us, because they are the ones that are at the front lines, and they're going to bear the brunt of our ignorance, of our refusal to hear them. Today, a stay-at-home order was issued by Minnesota's Governor Tim Walz. The order is likely to stay in effect for at least 2 weeks. I think it's going to go longer, folks, to be honest with you. But people in the state have gotten very upset. And as you know, President Trump had still stating that he wants to reopen the economy by Easter. By the way, folks, if you are worried about getting your real ID, the president has now postponed the real ID requirements that were due in October of 2020, and they are delaying the deadline. So that's one good piece of news. However, he still hasn't walked back his Easter reopening statement, causing a lot of people to believe that we are going to kill our economy. I know there's a lot of scared people out there right now. I get it, especially if you're a business owner, if you're an employer, if you're thinking about how you're going to make payroll, or whether or not you're going to have to go under or not pay your employees anymore, or what have you. Okay? I get it. There's a lot of fear out there, but we have to understand what the stakes are. Shortly after this announcement was made. A local former city leader in multiple positions of city leadership, including school board and county commission or city commission, city commission, made this post. And I'm not going to say his name. Instead, change his name to Mitch.
Mitch. It's actually city council.
City council,
Yes.
excuse me. The reason that this is important is that as a leader in your community, whether former or present, whether state or federal, people are looking to folks like this as barometers of what they should be doing, how they should be feeling, whether they should panic or not. And right now, giving instruction or insinuating in some way that your right as a citizen of this country to go out, to earn money, to make purchases, to participate in capitalism, trumps the right of other people to live. That a certain segment of our population is expendable because we need to keep a robust economy. That making sure that the dividends and the stocks maintain high revenue for those people that invested in them, even as bodies are piling up in our country. But unfortunately, that is not correct. We can never get to a point where we value an economy or an economic system over the people that drive it. Here's that post by Mitch. After the governor of the state of Minnesota issued a stay-at-home order, he said, "And eat exactly what, Tim? Is the state going to bring us food? Pay for my electricity? Cover our medications? People are broke, but the bills are still coming. Oh, but don't worry, Fargo will still be open." Wiped out retail on the east side with one short video. Nice. How about this? Ask the most vulnerable to stay home, and we will provide a 4-star isolation period for them. The best food, best cable, best booze, etc., etc., etc. Everyone else, go back to work and school. Keep the vulnerable voluntarily isolated from the population, not the population from the things they need, like money, food, worship, and entertainment. This is backwards. Let me tell you, the reaction to this post on social media was harsh. So for those of you who have those feelings and voice them publicly, know that people will react, especially if they are healthcare workers, with hurt and possibly anger. And not only them, but all of their loved ones and everyone that is worried for their life and their safety. One such person answered Mitch and said this: "I work in healthcare, and we believe the virus has mutated, and there is no vulnerable, quote unquote, ones anymore. It seems to be a risk for all ages. We don't know who will need ventilators or not. And we definitely do not have enough personal protective gear. I called my children crying last Thursday because I was trained how to use the respirators and promptly told they weren't really available to us on an emergency basis. So, if a woman needs a stat C-section but has COVID-19, I will have to use the one N95 respirator that I get for the day and then hope that it's enough to protect me. And FYI, early studies show that the virus spreads more effectively during surgery. During wartime, our forefathers had been asked to make some significant sacrifices for the common good. And that is why I, as a healthcare worker, am asking you, my former schoolmate, to do that. My life is the life that you could be saving." Now, I don't know. I would hope that those words would get to Mitch.
Yeah.
I would hope that that would be enough to get to him, but sadly, I must convey to you tonight as I sit here, being in the United States after seeing this pandemic hit China, hit Spain, hit France, hit Iran, hit South Korea, and how all of those countries had the same frozen in place, should I believe this, going through the 5 stages of grief, trying to bargain, trying to deny, and finally landing or maybe kneeling before the tempest when it was already too late. Folks, if we do not, as human beings, have the wherewithal, the, giving of yourself for the betterment of the rest of mankind attitude that we need to have right now, we need to have the reverence and the respect and feel duty bound to support and help our healthcare workers and our first responders as if we were operating in a wartime scenario. Don't you think, Duke?
Yeah, for sure. I think we need to do everything and anything humanly possible, because this is nothing that we've ever dealt with before. And it's really evident that we haven't had this sort of hardship and potential hardship in our lifetimes. And people are reacting, and that's in a way that they still don't want to. I don't want to. But we have to. And it's a way that we can survive. It's really scary. I know people are all excited about the stimulus package, but what's $1,200 going to do for you if everyone's dying around you? We have to do a lot of things to adapt the way we do our day-to-day activities. We have to figure out ways to survive. And we have to do it as a community instead of just as individuals that are just looking out for themselves. So I think a lot of things need to change, because every day we're seeing more and more people balk at the ideas and endanger other people. It's not just themselves. They put everyone else in danger.
Look, folks, this isn't about Republican or Democrat. This isn't about whether you believe the president or you believe your state governor. This is a pandemic. This is a virus. It doesn't care what color, what creed, what religion you are. It doesn't respect your money, your power. It will infect everyone. No one is immune to it. And it is killing a whole hell of a lot of people, and it hasn't even made a dent. This is going to be going on for a lot longer. Let me give you an example so that you can extrapolate. This is for, coronavirus explained easily. Mm-hmm. Imagine this. Karen gets infected yesterday.
Yep.
But she won't know for 14 days or longer. She won't even find out. She may not show symptoms until the second week of having the virus, like many people. But Karen, during that whole time, she thinks she's healthy. She thinks she's one of the people that aren't vulnerable. Like they've been telling us from the beginning, if you feel sick, stay home. Only go out if you feel well. Well, Karen's feeling well for the entire 14-day period. So she goes out. And she infects 10 people every day. Every day she infects 10 people, and that's a conservative number. Those 10 people all think they're okay too. They travel. They go to other states. They go on vacation to Mexico. And they infect hundreds more. Those hundreds all think they're okay too. So they infect thousands more. No one in this scenario knows who's sick and who's not. Who's got the virus and who doesn't. Do you understand now why it is so important for you to stay at home? Let me tell you the story of a local healthcare worker. I'm going to change her name too, because as I was watching her daily update in quarantine, I found out today that not only her life, but her job is in danger because she has spoken publicly about her problem. This is from, she's in day 5 of quarantine today. And from her post, I learned she was afraid that she might lose her job for having spoken out. But this is what she posted yesterday. As a medical assistant, I know the possibility of exposure. I know what I signed up for. I wouldn't change it for the world. I know it's what I am meant to do. But today I found out my test, it was never run. The lab set it aside because I didn't meet the criteria for testing, even though I was sent home from work and told that due to a cough, I would need to be tested and that I may not return till I got a negative and it was symptom free. This means my worry of financial stability is increased, and I was told I will still need to wait another 3 to 4 days for the results, which also means once I'm cleared and put back onto the front lines, if I get sick, I have no paid time off to fall back on. The continued fear of losing my home increases since I cannot work. Fear of my own health increases. Fear of losing my family if I were to be positive increases. Fear of the unknown increases. My paycheck won't last me. My bills must be paid. There is no other assistance I can apply for per my HR department. I am again afraid. I feel isolated. I feel alone. But deep down, I know I am not. I don't post these updates for pity, but for a realistic idea of what we as medical people are going through and how your fears are just as much as ours. So think about that scenario in which healthcare workers, many of whom don't meet the criteria to be tested even on an emergency basis, may be sitting at home in self-quarantine and not able to earn an income. And also, they can't find out whether or not they're sick. I told you that there are many healthcare workers going through this. There are a lot of healthcare workers, she said, that have been either hit with COVID, contracted it from someone that they were treating, or they've gotten sick. And there are also people who are dying after exposure from their healthcare work. This is a very real fear that people like this woman have. I wanted to read to you this post from another nurse, which I think is really important. And what she asks people to do, I think we should all start thinking about. Instead of selfishly thinking about our own needs and what are we going to do and we run out of this or that, we should start thinking about the people that are on the front lines literally fighting to save our lives. Without rest, without adequate equipment, without adequate staffing. And think about how they feel day to day. She said, yesterday was hard. There have been quite a few healthcare workers who have been either hit with COVID-19 scare or have gotten sick. And then there are people who are dying after exposure in their healthcare work. This is one group of people that, as a society, have said, yes, we're going to go put our lives at risk every day. Now, I'm not saying that we have to get rid of that. We can't. And healthcare workers are making decisions every day to go into their jobs, regardless of the danger. It's part of the pledge that they took in order to become healthcare professionals. But here's the questions that you need to ask. Have you asked your doctor, your nurse practitioner, your pharmacist, your home health care aide, your social worker, your physical therapist, or others how they're doing? Have you made any extra efforts to wipe off your debit cards before handing it to the receptionist at the clinic? Have you asked if there's anything that you can do to help them feel more safe and secure at this time? Have you checked in with your healthcare friends to see how they're doing on childcare, or what their plans are for childcare and for their elders in their life if they were to test positive, or to get sick, or to die? One of my coworkers' spouses is days away from having their baby, but he keeps coming into work anyway, and he admitted he's terrified, as we all are. One of my coworkers shares custody of her child with her disabled ex, and they are both wondering what they will do if she were to get sick. Many of the people I know are spending 13-hour days trying to manage a whole lot of variables. Many, myself included, come home, fall out exhausted, and then have to try to figure out what to eat, because eating is forgotten during the day. Sleep, medicine, enough water, not too much caffeine, eating, just the basics. When you're with someone you know is working in healthcare and is still going out daily, check in with them. Do they have what they need if they get sick? If they get quarantined? How are they managing the stress and the emotional toll of their work? Have they eaten? Have they slept? Have they drank enough water? Have they taken their meds? And try, if you can, to be conscious of how much time you spend talking about stay-at-home activities, because this is not something that they're spending time doing, even as they can and will listen to you tell your stories about all of your stay-at-home activities. They can't do that. And whatever you do, or whatever you do to support people when you can't engage directly with their needs to support, do that too. In love and in solidarity. And that's how we have to think right now. In love and in solidarity with our healthcare workers, with our first responders, because now more than ever before, the idea that they are literally putting their lives on the line is very, very real. This can also extend to our postal workers. Postal shutdown is imminent unless they can get some help. The Business Insider reports the coronavirus could shut down the postal service in less than 3 months.
Wow.
Yes. So a bill is being put forward to request $25 billion in emergency funding for the Postal Service, while eliminating the agency's debt and requiring it to prioritize medical deliveries.
You know, there's a really good point there that I've been thinking about a lot, is that people are going to continue to get sick. And how do you replace the workers in these industries, like in the hospitals and clinics? You know, the people that we have to fill it with skilled people. The post office shutting down would be devastating, because it's our goods. The more we sit in isolation, we need to have things delivered to us. And if that ends, we're going to not be able to have things delivered to us. And that's going to be it's going to be devastating. But you can't just recruit a bunch of people and make them postal workers. That's another skilled position. It's another layers of bureaucracy that they would have to go through to be an employee of the post office. You know, it's like, it's testing, it's these levels, it's these applications, all these things. And the same thing with healthcare. You know, I worked in a hospital for 5 years. I worked in a microbiology lab, and I was a phlebotomist. And I worked in a clinic that was connected to a hospital. And I actually was in the era where they would train you on the job. You know, now you have to go to school for both those things. But at the time, I was basically trained on the job. So I can really relate to these stories that are being read tonight, because even back then when I was doing that, I was young. I was only 19 years old. But the workers were very dedicated. I was dedicated to be there every day. And I was working around blood, you know, and I was working around dangerous, you know, things that were dangerous health issues and people in quarantine and all sorts of things. And I took it real seriously. So, but I'm thinking about how do we replace workers as people get sick? 'Cause I think it's a really big concern.
It's already happening. In New York, a lot of their EMTs are getting sick with coronavirus,
That's right.
as are their police officers.
50% of their whole personnel and first responders are sick.
They have the virus. What happens when our first responders go down? We're all screwed.
Yep.
That's what's going to happen. And folks, we really have to start thinking about and looking around us and seeing what's happening everywhere else. Let me share with you how bad things have gotten in Spain. The Spanish military went to the senior homes, and they're finding dead bodies decomposing in their beds. The people got so they got so overwhelmed with the number of deaths that normally they would have stored them in the cooler until somebody from the morgue could come and pick up the bodies.
Mm-hmm.
And they had to have people that are appropriately hazmat suited to come in to remove bodies with the coronavirus, because you don't want to make anyone else contagious. And most senior homes don't have that kind of
facility.
They don't have the kind of equipment to do that. So they had to leave the dead in their beds.
Oh, boy.
And, of course, as I just pointed out, most places have not had the capacity to keep the dead bodies. So now they've turned an ice rink into a morgue.
Yeah.
Maybe that will happen here in our community. Who knows? Somebody posted this article about how Spain turned this into an ice rink, and they said, at least our country will be totally fine by Easter.
Yeah.
Facepalm. No, it won't.
No,
it won't. I know that they were being facetious, but the reality is that we're not going to be fine. Everything is not going to just be okay. And, folks that are worried about going out, getting food, you can order. There's a whole list of restaurants. I'm going to have a link for you in the comments of our show. You can also go to www.fmwfchamber.com/local-restaurants and find all the places that are curbside delivery or takeout.
I looked through that list today. I was pretty impressed because I didn't realize there were so many places in this community who were able to deliver foods. And some were using DoorDash, and so they're partnering with other delivery systems. And I'm looking down the list, and not that I go there very often, but it was like, McDonald's will even deliver your food now.
Really?
Yeah,
Yeah, through DoorDash.
It said through DoorDash, and I thought, oh, okay. But there was lots of choices, and it's a great way to be able to get your food without having to go out and encounter any people.
Mm-hmm. And to support your local businesses,
Yes.
right? So here is a video of healthcare workers talking about what is happening on a national level. Take a listen for yourselves.
I find it very discouraging and disheartening and wrong that I watch the news and see basketball players and celebrities that are asymptomatic being tested because they were possibly exposed, but yet I myself and others, frontline staff that are interacting with patients who are symptomatic, are being not tested or a delay in testing. I find that very upsetting. I'm using my sick leave and currently have ran out of my sick leave and are basically just not being paid. I could say I'm disappointed, not only in my employer, I'm disappointed in our nation for the lack of readiness. I feel like nurses, we have screamed at the top of our lungs through H1N1, through Ebola, that we need to be prepared, we need to be ready. And I feel like the short-term readiness or training as it's needed it's not right.
National Nurses United.
Wow.
It makes my heart weep, Duke.
Mm-hmm.
It makes my heart weep for these healthcare professionals, and you could hear Her voice was cracking as she told her story because the reality sets in that they can't get tests. They're not a priority, even though they're putting their lives on the line. They get to see how celebrities and politicians and people in power can easily get tested, but emergency workers, frontline workers, are left abandoned on their own. And to add insult to injury, the response from the public is to complain about the difficulties that it will present to us economically, or the boredom that we will have to suffer through to stay in place so that they can have a fighting chance to do their jobs and to save the lives of people that are dying. Well, in Mexico, as you know, the response has been very slow, but states are now stepping up, since the president won't. States like Nuevo León, who are now putting out police in the public spaces and telling everyone to go home. Here is video footage of what they were doing in this Nuevo León town. There's police officers out with protective gear on, telling people to get off benches. You can hear on a megaphone in the background. People are being invited to return home for their own protection. We're trying to protect the health of your families. Prevention is everyone's duty. That's a very important message.
Yeah.
Prevention is everyone's duty. Prevention is everyone's duty, and that is the truth for everywhere around the globe. It is our duty to prevent others from getting this. Folks, with the heightened fear around the country, there's going to be a lot of people that are going to try to scam you, to take advantage of your fears. Here is a report from the Inspector General. I will share a link to the Inspector General's page so that folks can go to www.oig.hhs.gov and /coronavirus /fraud-alert-COVID-19. Check out this warning from the Inspector General to scammers. About scammers, they're targeting beneficiaries across the country, preying upon people's fears for profit, and perpetrating fraud schemes, including marketing fake COVID tests and unapproved treatments through telemarketing, calls, social media platforms, and even door-to-door visits. Do not share your personal information, such as your Medicare number, with anyone other than a trusted healthcare provider. If you think you're the victim of a COVID-19 testing fraud, report it immediately. oig.hhs.gov, or if you want more information, you can call 800-HHS-TIPS, TIPS. If you need to report fraud, you call the National Center for Disaster Fraud Hotline. The number is 866-720-5721. We got to watch out for those fraudsters because they're always going to try to take advantage of a natural disaster, an emergency of any sort. That's what they're there for.
I know, and stuff like this, people are more vulnerable. You know, you're scared. You want to take care of yourself, and so the scammers are coming up, and you just be on the lookout for stuff like that. And I really appreciate that people are putting out those sorts of messages, and we're going to be running a similar PSA on our radio station throughout the day so people can be more aware.
I have a question for you, Duke.
Yes.
Do you know what a covidiot is?
I can make an assumption what one is, but...
A covidiot, by the way, it's a new word.
Okay.
It's in the Urban Dictionary. They just added this word because of all of the lunacy that we're seeing around this pandemic. For your information, a covidiot is a stupid person who ignores protocols like social distancing, thus helping further the spread of COVID-19. Anybody that is doing anything that helps spread the virus rather than flatten the curve is a covidiot. An example of how you use that in a sentence is, are you seriously going to visit grandma? Dude, don't be a covidiot. Or it could be a stupid person that's hoarding groceries, needlessly spreading fears, depriving others of vital supplies. You get the picture, right? Do we understand what a covidiot is?
Yep.
Okay, let's take a look at some covidiots. Here's one that went to Walmart and claimed that he had the virus when he did not.
Oh, really?
Remember I told you there's going to be a bunch of covidiots that were going to come out and tell people, I have the virus.
Yeah, that's right.
And either try to scam people out of money or use it in some other form to scare people.
Yep.
Well, here's another covidiot.
Mm-hmm.
He was out trying to scare people, but he got arrested and will be charged. There's also these covidiots that decided to throw a coronavirus party.
A group of young adults.
Yeah, adults.
Yep.
They held a coronavirus party in Kentucky to defy the orders of social distancing. I mean, this reminds me of the people that did the you know what the coronavirus challenge is, right? On social media?
No.
Like on TikTok or one of those platforms, you've got a bunch of these covidiots licking toilets
God.
and door handles to defy the virus.
Oh, boy.
What you don't understand is that you may not die, but you will likely infect and kill other people. This is not the time to be a covidiot. Okay?
Well, with that group of young adults who threw that party,
yeah.
one of them got coronavirus.
After they threw
the party.
Right,
Yes.
of course, because they're covidiots. Of course they're going to get it and spread it.
Yep.
There was also another group of covidiots that decided they would throw... well, this is a post. Remember Twitter enacted rules that say that you cannot put out false information that will help spread the virus?
Yep.
People are reporting posts that they think are doing that, and this is one of the posts that they think should be removed. It's by the Federalist, and it says, it's time to think outside the box and seriously consider a somewhat unconventional approach to COVID-19. Controlled voluntary infection. How chickenpox parties could turn the tide of the Wuhan virus.
Oh, my God.
They're basically saying we should go and find and get contagious so that, I don't know, so that you can die. That's all I can think of. It's a stupid idea. I don't suggest that you do it. And speaking of dumb ideas, I wanted to bring you some of the Standing Rock phony nonsense I've found online. Thank you to those who send it to me, who share it with me. You know who you are. Mwah, mwah. And tonight, I will start off with the fact that Greta Thunberg, who shared to her nearly 10 million followers on Instagram that she more than likely has the virus, but she talked about it in such a way that she was saying that the pandemic proved what she was saying that we needed to do about climate change.
Yeah, exactly.
Tim Pool did a much better job of explaining what was behind her post, basically exploiting her non-diagnosis because she doesn't have a diagnosis yet, and conflating it with the need for climate change. Here is that clip.
Greta Thunberg revealed on Tuesday it's extremely likely she had COVID-19. Thunberg broke the news on Instagram to her 10 million followers, saying she and her father began to feel ill around March 14th after returning from a trip to Brussels. Now, one of the things she said is that this proves she was right. about how the world can mass mobilize when it's facing a true crisis. Perhaps that means something you don't realize. Greta looks at how we've shut the economy down, and she's not really bringing it up, but check this out. Traffic and pollution plummet as U.S. cities shut down coronavirus. A lot of people have pointed this out, saying, why won't Greta Thunberg point out all the good things that are happening now? I don't think you realize this is what she was talking about. She was actually talking about shutting down economies so that this would happen. I do not believe, well, I think it's fair to say that it's true. Governments can mass mobilize to a crisis. And she points this out, but I think there's kind of a whoosh phenomenon, whoosh right over the head. Perhaps that's because it's not a crisis. I think global warming is a serious threat, but is it an existential threat on the level of, the coronavirus? No, the coronavirus could kill millions of people. When it comes to climate change, we have speculation and probabilities. We know, according to the scientists, that it will be bad for us in the long run. But as much as the doomsayers have tried to scream 12 years until the end is here, they've been saying that every 10 years. So no, that's not the case. There will be a change to the economy, to climates, to living standards. There could be bad, consequences to climate change, but it's dramatically different. And maybe she missed this one, but perhaps nobody cares about climate change because it's not that pressing of an issue.
And here is another COVIDiotic post. This one is painful. It's cringeworthy. Do you remember Brennan Anastasio from Standing Rock, the guy that says that he disarmed this Kyle Thompson, the pipeline worker that brought a loaded weapon into the camp at Standing Rock?
Yeah.
Well, Brennan, who's about to be married soon, posted this COVIDiocy. It's all I can call it.
That's right.
Brennan. This is sad. And for the record, anybody using their water protector status, their hero protector status, their sacred earth protector status, their Standing Rock cred to spread lies, misinformation that would lead to people not getting treatment, not staying at home, to spread the virus, or in this case, not to take any eventual vaccination that may come along, is a COVIDiot. And you need to be stopped, and you need to be shunned and shamed for the saying of things as stupid as this. Brennan said, population control, quarantine camps. We must come together. They will try to vaccinate all of us. The vaccine will have more toxins, poisons, and the computer chip that they insert in you without you knowing. It is a new world order why you think the rich aren't worried. It's all based on fear. This here existence of this virus is nothing more than the common cold or flu. There are more deaths from the flu than this virus. If we do nothing, it's a betrayal to our children and our grandchildren. Why does he sound like Donald Trump right now?
Right. Yep.
Why does he sound like people that are not trained medically? Why does this person sound like they are completely ignorant of how a vaccine works? You can't get a vaccine and put a computer chip in people through a vaccine.
Really small one.
That's crazy, dude.
I know it is. I think it is too.
It's nonsense. It's like sex, what do they call it? Child sex labor camps on Mars?
Oh, yeah.
That kind of crazy.
Yep.
That's how crazy this is. You're not only telling people that this is equivalent to a cold or a flu, which it is not. It is 10 times deadlier than the flu. Plus, it's going to overwhelm our healthcare system, and it's going to kill a lot of people. And he's already going for the vaccine.
Yeah.
When the eventual vaccine comes out, he's already scaring people into being anti-vaxxers. Don't get the vaccine.
Yep, there's computer chips in there.
What's wrong with you?
Exactly.
Why would you say that? Oh, let me tell you. People in his feed did not let it go. A friend of his said, Brennan, I agree with you on most things, but this virus is much deadlier than the flu. Most people die of the flu each year. Sure, yes. But this is the first time we've seen this virus, and its kill rate is 2 to 3% of those infected versus 1% for the flu. Also, it's much more easily spread. This is important not to ignore the risks of potential spread.
Mm-hmm.
And his fiance, Josie Tenorio, is telling people that this is a form of population control to get rid of the elderly.
Wow.
No, it's not. Don't spread lies like that. Both of you should know better. Both of you should be ashamed of yourselves for scaring people.
Mm-hmm.
There's a lot of elderly people. These are people that have been put in places of leadership to protect the vulnerable, like missing and murdered Indigenous women. People look up to you for information and guidance, and you're giving them lies, speculation, conspiracy theorists about how they're trying to kill elders. Another woman who works in healthcare said, why don't you tell that to the 26 people put on respirators overnight at the University of Minnesota hospital? I'll let myself out of this conversation. I don't need this kind of misinformation.
Mm-hmm.
And you would think that maybe after seeing some of these posts that they would desist, but no. Josie Tenorio Tewa jumps in to say something even more COVIDiot.
Yep.
Why would you think it's misinformation when anything and everything is possible? No, Josie, no, it's not. You can't inject chips into people in vaccines, okay? That is just a made-up lie. And then she goes on, just like all phones and computers already have cameras, they hear and see us. When all oil companies already destroy many sacred burial sites, when all sisters and brothers are being murdered, and still to this day there's no justice, and our women are still missing. When they're women who are never thought they would be able to conceive, and now they can. Yes, anything and everything is possible. Stay woke. That's not being woke.
That's right.
What you're doing is spreading misinformations and lies. I cannot wait. I cannot wait until Facebook has some restriction where they put you in Facebook jail for spreading lies that fearmonger or that help to spread the virus, because you would be candidates to go to Facebook jail immediately. And this virus is spreading to the rich. Unlike what Brennan was saying, that they're not scared. Of course they're scared, and they're getting it. More and more world leaders are getting it. The last one was Prince Charles. He's tested positive for this virus. And of course, they were scrambling to figure out when the last time he had contact with the Queen was, because they were afraid he had infected his own mother. Yes, world leaders are going to die. The Minnesota Congresswoman, Amy Klobuchar's husband, is on a respirator.
Yep.
Okay, folks? This is no respecter of persons. You can be rich, you can be powerful, you could be a politician, you could even be the president, and you can still get this virus, and yes, it can kill you. But there's some hope. The UK has already developed a home testing kit which might be available within days. Can you imagine what we could do? It's a fingerprint blood drop test.
Yeah, that's great.
You get results like in a home pregnancy test. This could be a game changer. It definitely will be a game changer for the UK, but more so if we can get something like this here so people don't have to leave their homes to get tested, and that we can turn the tests around in a relatively short amount of time. That would be ideal.
Yeah, I like the finger prick too, compared to the swab all the way into
tickling your
head.
Brain through your nose.
Yeah, so I think it's a better solution.
Oh, I'm sure
easier to do.
I'm sure a lot of people would like that. Here's another example of a leader. This is the president of the Philippines Senate. His name is Coco Pimentel, in case you didn't know who the president of the Philippines Senate was. And this is a complaint about how he has behaved. It says that he knowingly infected a bunch of people. He tested positive for COVID-19, but he still had the audacity to expose doctors and nurses and the sick that were in the hospital he went to because he was being self-centered.
Wow.
And there's a post accompanying it that reads that he knew he was positive for a couple of days. He recently went to Makati Med with his pregnant wife and didn't disclose that he had COVID-19, that he had already tested positive days before. Only when a private doctor called the hospital and stated that he had it did they find out. And since they were at full capacity when he showed up with this pregnant girlfriend, they weren't, she wasn't accepted. So he called and complained. The way that the story got out was that, you know, the hospital administration chewed out its staff for not letting the pregnant girlfriend in during a pandemic emergency.
Jeez.
And then it was determined that, oh, by the way, her husband, the president of the Senate, had COVID, came into the hospital and infected people.
Yeah, boy.
Well, there is a silver lining to all of this. If you are ordering food, you can now order. If you live in Portland, Oregon,
yes.
you can now order from Boober Eats.
That's
yes,
right.
I said Boober Eats. And what it is unemployed strippers, or Portland Strip Club is forced to close down, so the dancers at the strip club are now delivering food.
Yep.
Now, just because a stripper comes to deliver the food at your house, I mean, you can look at them through the window, maybe tip them to show
That's
you
right.
some extra cleavage, but do not interact with your takeout delivery people.
With
okay?
your stripper at your door delivering your boober eats.
No
contact. You know.
No contact.
Mm-hmm.
And folks, although the states in Mexico are finally doing something, I wanted to share with you. This is so sad. Even in Switzerland, in Zurich's newspaper on the front page, they were mocking the president of Mexico, saying the president of Mexico is the worst example of how to prevent the coronavirus. Meeting at rallies with people, shaking their hands.
Yeah.
Still spreading the virus for as long as he enjoys himself in doing so. The scary part, folks, is that even in places like China where they have flattened the curve, reinfection is happening. A whistleblower doctor said that the reinfection is even deadlier than the initial infection of coronavirus.
Wow.
And that's because it causes heart tissue damage. In this article in the New York Post, it tells us that, excuse me, the medicine that's used to treat this condition damages the heart tissue. A physician said that the medication used to treat this can have negative impacts on the heart and lead to cardiac arrest.
Oh, wow.
A few of the people recovered from the first time they got the virus, but the damage to their heart meant that the second time around, the antibodies didn't help them because the damage was to their heart tissue, and they would suddenly die of heart failure. What's even scarier is that this virus, once you've gotten it a second time, can very easily trick the tests that they use to detect it. One doctor said that the virus has outsmarted all of us. In one case, he said it was able to hide symptoms for up to 24 days when you get it the second time.
Really?
So you have it and don't show symptoms for nearly a month, which contradicts current guidance that the incubation period is only 2 weeks. So I wanted you to think about this with regard to these stay at home orders for 2 weeks that have been issued in most of the country. We now know that people can get reinfected, and we now know the incubation period for this disease is probably longer than 14 days.
Yeah, it seems like a lot of things are indicating that. It's because we haven't known that much about this. By the way, you're listening to KPPP LP 88.1 Fargo Moorhead, adding local color to your airwaves.
And here on a Mexican Crossing Lines, I am doing Radio Rona, Rona Radio, daily reports on the coronavirus, curating all of the most important information about what's happening with the virus from the United States and around the globe so that you don't have to.
That's right.
So they say that the scariest part of this reinfection is that infected patients often returned false negatives multiple times before eventually being diagnosed with the illness. That's happening on reinfection, but it's also happening on initial infection. Many people here in the United States are getting tested, being told they don't have it, being sent out into the world, only to fall very seriously ill, and then return to the hospital and then be finally diagnosed as a positive.
And infecting a bunch of people.
Meanwhile, infecting lots and lots and lots of people. So for all the folks that are out there very, very angry about these orders, that we should stay at home, very, very angry about what's happening to our economy, remember what could happen to lives. Things have gotten so bad out in Turkey that people are leaving packages out in the streets so that folks that haven't been able to work, folks that haven't been able to buy groceries, folks that haven't been able to, get things delivered to them, have resources. Even in countries like Turkey, they're not on they're not on the level of the United States. The kindness and the empathy for our fellow man comes out. Here's a clip. Take a look. It's a street full. There's no cars.
Yeah.
But you see
Groceries in piles.
groceries in piles every,
4 or 5
5 feet
Yep.
apart. Everywhere in the streets. People that don't need them, don't take them.
Yeah.
People that need them, pick them up. Folks, I want to encourage you. I know these are scary times, but I want to remind you of the ingenuity of the American spirit, of the kindness of the American people, of the resiliency and the strength of the American people. I want to remind you of how resourceful we are. I was just reading an article last night that a surgeon at the University of Minnesota MacGyvered a ventilator pump out of $200 worth of parts they had in their lab.
Yeah.
People here are going to come up with ways of helping each other, of fixing our problems. We are greater than the sum of our parts. And we will get through this. But we have to stick together, and we definitely have to give our 100% support to our healthcare workers. In Japan, we have some more COVIDiots.
Oh.
During the cherry blossoms, they're not really taking a lot of action yet in Japan. It's there are already cases of COVID virus in the country, so you'd think that they would be more cautious, but they all went out to enjoy themselves when the blossoms came out.
Boy.
Despite the fact that the leader of Japan was still gung-ho for the Tokyo 2020 Olympics, it was finally postponed. Thankfully, it was postponed. And I get it. It's heartbreaking for all of the people in sports, whether you're an Olympic athlete or you're a high school athlete or you're a college athlete. You're not going to get to play your games. You're not going to get to perform. I know it's heartbreaking for all of the people that have trained, some of you, all your lives, for your chance to show that you are at the top of your field in sports, and that has been ripped away from you by this pandemic. But once again, I want to remind folks that we have to stay united, because we don't want what happened in Italy to come to our door. And sadly, we're already on track to do the same thing. Take a look at some of these images of people, the situation during the lockdown. During the lockdown, do you see this crowd of people? There are hundreds of people. There are hospital beds outside.
Mm-hmm.
Take a look at this photo. They're lined up against the side of the hospital. Rows and rows of hospital beds. We don't have enough hospital beds here either.
No.
Take a look at how people are just in lawn chairs with IVs sitting on the grass outside.
Yep.
Covered in blankets. There's no beds. There are no beds. You want to get treated in a lawn chair on somebody's yard?
Exactly.
Because that's what we're going to be forced to do. Already we have people getting treated in parking lots. In Italy, they're getting treated out in the middle of the street.
Wow.
They're standing there. For if you don't get a chair, you just got to stand there in your hospital gown, holding your blanket around you. This is real, folks. I'm not fear-mongering. I am sharing what's happening. And it can and will happen to us if we don't do something about it. And I mean right now. Listen, not to politicians. This isn't political. Don't listen to people that aren't in there fighting on the front lines. You have to hear from the people that are putting their lives on the line for you and saving lives every day, the doctors. Here is a clip of those doctors speaking to the Today Show.
Beyond working grueling hours, the medical personnel fighting this virus on the front lines also face the greatest risk of infection. Dr. Derek Cass is a New York ER doctor. Dr. Cass is also now in isolation after testing positive for COVID-19. She's also an associate professor of emergency medicine at the Columbia University Irvine Medical Center. She joins us this morning from her home in Brooklyn. Dr. Cass, first of all, how are you? How are you feeling this morning?
I'm feeling very lucky. I actually today's day 10 of symptoms. So based on the course of illness, I'm going to consider myself COVID case closed. And I'm going to consider myself ready to go back to at least telemedicine for now, which is where I do some of my shifts anyway.
Good news. When did you start feeling symptoms, and what were those symptoms? How did they present?
Yeah, so my symptoms were actually more of the mild symptoms. I had some muscle aches, some fatigue. I started developing this really insidious cough that started out of nowhere, and my friends were like, "You're coughing a lot." And I was like, okay. And then 2 days later, I called for a telemedicine visit, a virtual visit, gave my symptoms. They felt because of my risk factors and symptoms, I qualified for a test. I actually felt very fortunate to get a test because it's not easy for all the New Yorkers with these symptoms to actually get tested. And I found out actually within the same day that I was positive.
And to be clear, you never had a fever, right?
I didn't have a fever. I consider myself very lucky to have not had a fever. It was my proximity to patients that were known positive at that time that got me qualified for a test. And that decision-making is changing every single day based on the number of cases we're seeing in New York City.
Doctor, this is Al Roker. Tell us about the range of severity with this illness that people can feel.
So there's a huge range of variability, and even us in the healthcare field don't know how we're going to react when we find it. I found out a good friend of mine, same age, another physician, another mother, was admitted to the hospital last night with her symptoms, and I think she's going to do well. But there is no predictable time course. We know that you can be short of breath, have a fever, just have the muscle aches. The loss of taste is a super interesting feeling. You feel like everything is really metallic. The muscle fatigues, and then the shortness of breath, the cough. Some people have blood when they cough up. And if you're short of breath, that's the symptom we really worry about, because the patients that need to be admitted to the hospital need to be admitted for supplemental oxygen and sometimes to be put on a ventilator. And those are the patients that we need to keep the lanes clear for to take care of.
Dr. Cass, the president has recently said he'd like to have the country reopened by Easter. That's April 12th. What's your feeling about that?
So I would love this to go away too. I really would. I would love this to think that we can just say, okay, we've done our good part and it's time to open the doors and restart the economy. That's not how this works. The only way we take care of the sick people that need us is to suppress the new cases, which requires us to stay home. I know it's not convenient. I know it's hurting our economy. I know that it's painful in lots of new ways, but we have to do this. Just because we're tired of staying home and we think that this is having an undue effect on our economy, it's not going to get better if we don't address the cause of the economic situation we're in, which is this virus.
And doctor, you and your husband, as a precautionary measure, moved your 2 kids out of the house. Now that you're COVID-free, and I'm assuming maybe your husband is, are the kids going to come back in? How's everybody doing?
So I have 3 kids. So whichever the third kid that got forgotten probably needs me to recognize that. The answer is, I don't know. I don't know. We haven't figured out exactly what the risk factor is after you are, you've recovered from it, and then am I going to bring it back into the house after going back to work? So we're going to wait a little bit and try to accumulate more information. My kids are at Camp Grandma and Grandpa and Aunt Stacy and having a pretty good time. So I'm going to leave them there for the duration.
Yeah, you can't beat Camp Grandma and Grandpa. That's the best. Well, Dr. Derek Cass, thank you so much for taking the time to talk to us. Again, stay healthy, and I hope the kids are okay as well. Thanks so much. We appreciate that. Craig, good advice, I think.
Yeah.
Just to wait and caution's the better part of valor.
Yeah, caution is the better part of valor. That's very important that we support our healthcare workers, and a lot of them are falling sick, like this doctor. And again, she talks about how she has to quarantine. That means she can't go home to her family.
Yeah.
And for the people out there, that say that, okay, well, God's going to take care of me if I'm going to die or if I'm not going to die. I'm a religious person. I pray every night. I've been praying a lot about this pandemic. But I will tell you, you must quarantine. You must stay at home. You must protect yourself and follow the rules. If you're out there licking toilets and handling doorknobs, not self-distancing, not, going out and having beers with your friends because you can, because there's not an order in place yet, you're going to get it. I found this funny meme that was addressing it.
Yeah.
It was Jesus knocking on the door, and it says, "Hey, Debbie, it's me, the Lord. Listen, you need to stop telling Facebook that your health is in my hands. You're going to have to wash your hands and quarantine with everyone else, okay?" Yes. We have a saying in Spanish that's very similar, that you need to ask God for guidance and support, but you also have to do your part to get there. You can't just put it all in God's hands. Your hands are involved in all of this too. Thankfully, Jacksonville, Florida, is now taking steps to mandate everyone to stay home. Everybody has to work from home if they can, and those that don't follow the orders of the city will face fines and citations from the fire marshal.
Wow.
So, I'm glad that they are putting these things into place. Florida, you might just have saved a bunch of people. They had a lot of people going to the beach up until very recently.
That's right.
And this is why people are saying that we've handled this the wrong way. The United States is handling coronavirus worse than any other country. Worse, the worst. Look at what Hong Kong did. Do that. Don't do anything else. Stay at home. Staying at home saves lives. Check out the USA trajectory. This is chilling. Take a look at this map that shows you most Western countries are on the same coronavirus trajectories. Hong Kong, however, Singapore, they have limited spread. And Japan and South Korea have slowed the spread. Are you seeing that?
Yeah.
Do you see how all of the other countries, their numbers are doubling every 3 days, every 2 days, or every single day? And yet, And we're right at the top of the leaderboard of doubling. We're at 2 days, doubling every 2 days. We need to get down where South Korea is. See how their curve literally is becoming a flat line?
Yep.
They are flattening the curve.
That's it.
We are flying up into the atmosphere. We need to stop this because we aren't just risking the lives and the happiness and the livelihood of the medical professionals. We're also affecting all of their families. Take a look at this heartbreaking video of this doctor, one of the people that chose to go home. I can understand why many doctors aren't going home. They have to find a different place to live while this pandemic is happening so they don't infect their families, so they don't infect their kids or their parents, their elderly. Take a look at this heartbreaking video of this child running to the door, posted on TikTok, of a Saudi doctor coming home, and the child runs to his dad, and his dad puts his hands up, nope. And it's so devastating that he just breaks down and cries. Take a look in slow-mo. He puts his hands up. The little boy takes a step back, and the father bends down and then just covers his face and begins to sob. How do you explain to a toddler that daddy can't hug you today? That he doesn't want to risk your life? This little boy must feel like his dad doesn't care about him.
Yeah, it's hard to understand.
He's
He's so excited to see him too, you know.
Yes, he can tell he loves his daddy. He just wants to give him a hug. And imagine how touch deprived healthcare workers are right now, so that they can go back every day outside, risk their lives just by going outside and then going into COVID infested hospitals to try to save yours without the proper equipment, well, don't take it from me. Let's listen to doctors complaining about what they're dealing with under the pressures of this virus. I'll share the article.
I'm an emergency medicine doctor in Portland, Oregon.
I'm Margot Snyder.
Dr. Robert Morin.
If you're sick with COVID virus needing hospitalization, most likely I'll be the one who will be taking care of you.
These are simply not normal times.
I'm Dr. Adam Friedlander. I'm the Director of Pediatric Emergency Medicine at Northside Hospital in Atlanta. We're all talking about buying the right mask on eBay. We're going online and trying to see who might still have something in stock. I spent roughly 10 times retail for 2 masks that I hope aren't expired. The CDC came out with a recommendation that when these supplies run out, we may want to use a bandana tied around our face. The fact that a recommendation like that came out from the Center for Disease Control is mind-boggling to me. What do we do when half of your doctors are out on quarantine? You have no more beds, all your ventilators are used up, and there are 1,000 new diagnoses in a single day. What do you do then? That's what we're bracing for.
We do not have enough to last us for what's coming. I'm a practicing emergency room doctor and the leader of one of our groups here in the Central Coast of California. We know that we don't have enough N95 masks. We know that we don't have enough what are called PAPRs, the special type of hood that people use when they intubate or place a patient on a ventilator. We're trying desperately to get our hands on these. The hospitals are ordering them and they're not showing up. We're seeing healthcare workers get sick at a much higher rate than the general population. These are young, healthy, go to work every day physicians and doctors. Without the protection, you're going to lose us. You're going to lose physicians and you're going to lose nurses. And if you lose them in a small community like we are in, then you don't have a backup for that.
I mean, I've never used any of these items for more than a single patient because of the risk of transmission. We generally take them off right after a patient and put them right into the garbage can. I mean, we're really going into crisis mode.
We're getting no support. That's the bottom line. We're getting no support. And in fact, we're getting the opposite of support. You know, we have to fight with a shortage of protective equipment. We have to fight with hospital administrators who are threatening to discipline us if we protect ourselves. A patient comes into the emergency room for something completely unrelated. They're cared for by, 20, 30 different healthcare providers. And then a day or 5 days later, we find out, oh, that patient was infected.
We are at higher risk than general population to catch the infection and to perish from this infection. I'm working on my living will, and the same concern has been raised by other healthcare providers. And that may sound gloomy to most. It is gloomy, but it is a fact, and we should be prepared for that. Yeah, very scary.
We're stepping up and we're battling this virus, but we need support.
We need this equipment to keep us safe.
The greatest risk that we face right now is overwhelming our healthcare resources. And that's not just filling up beds and using up all of our ventilators. It's knocking out our workforce if they become ill.
We're going to come every day to work. We're going to put our lives on the line. We're going to do everything we can to save your life. And so we need your help to make that possible.
You know, things are really dire in certain parts of the country. One pregnant nurse told us that while she has no N95 mask, she's been told she must report to work. She didn't want her name used for fear she'd be fired. You know, help is on the way. We just have to hope it's going to get there soon enough before it's too late.
Wow.
My heart breaks for all of my friends and family members who are in the healthcare profession. Between the two of us, we have probably over a dozen people in our lives that are nurses, that are PAs, that are doctors, that are assistants. My youngest daughter is working at a nursing home, has to go in every day, is considered an essential worker. And frankly, we're afraid for their lives. Mm-hmm. But a familiar or friendly tie to a healthcare worker, professional, or doctor, or a first responder shouldn't be the only reason why you're concerned right now. It shouldn't take having a direct tie to someone that possibly will that likely will end up. I know that before this is over, we will all know someone who has lost their life to this virus, especially in healthcare and first responders. And my heart breaks for them. And the hardships that they're going through, for us to act callously is just adding insult to injury when they are literally sacrificing everything. Tammy, take a look at this one doctor living in his garage inside of a tent and going to work. Can you imagine how uncomfortable? People are complaining about how bad it feels to have to home quarantine. This guy has to sleep in a tent, probably after working 13, 14 hours.
In a garage.
In their garage, because they don't want to spread the virus to their family. They're so concerned about the health and well-being of their family, they're willing to sleep outside in a tent. And never forget that for every one of these healthcare workers that falls ill and dies, we are depriving people of their mom, of their dad, of their aunt, of their grandma. Here's just one of the many little children that has posted on social media a message, a plea. This young man says, "My mom is a doctor. She stays away from me to help you. Can you please stay at home to help her?"
Wow.
It's the least that we can do. The least that you can do is to stay home. It's really not that bad. Unless, of course, you're a cat. I hear cats these days are really having a tough time because as this pandemic has proven to us, they've always thought that they own the humans and not the other way around. That's right. And the house. So your cat probably thinks that you're spending too much time in his house. This cat sure did. In fact, it even told its owners to get out. Listen how clearly you can hear this cat say, "Get out." Let's take a listen for yourself.
Our cat does not like the fact that we're all home quarantined. She's like, "Why are you in my house?" Sorry. Oh. Okay.
Did you hear it?
Yeah, I did.
I was like, oh, the cat suddenly has the gift of language because it's so annoyed. Mm-hmm. I figured I'd give you a little tiny bit of levity to go with that hefty dose of tough love. But I also want to remind you that we have to do everything right now that we can to support healthcare workers and first responders and flatten that curve. Thanks for being with us here on A Mexican Crossing Lines with Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You've been listening to 88.1 FM, KPPPLP, Fargo Moorhead, where we are adding local color to your airwaves. God bless you and good night.